Hmm.
The other diet thing, which is super important, is actually protein intake. And here we're thinking often about the older who sometimes have very poor protein intake in their diet. Yeah.
Mm. Yeah. So the current Australian recommendation is sort of zero point 0.8 grams per kilogram of body weight. But there are some suggestions that a different number might be better for bone health, Dr. N.
Yeah, so at least a gram a day, a gram to 1.2 grams per kilogram might be better for bone health. And really, it's about maintaining your muscles. And as a slight aside, we need to be clear what that zero point 0.8 grams per kilogram is, because that's zero point 0.8 grams of pure protein.
Mm.
So if you have 100 grams, say, of chicken breast, that's actually only 30 grams of protein. Yeah. And cheese, for instance, 100 grams of hard cheese, I think would be something like 25 grams of protein. Because otherwise people go, well, I'm 60 kilograms. I easily get 60 grams of protein a day. But no, you easily have 60 grams of meat or cheese or something a day, but that actually doesn't translate. So I think that can be confusing to the layperson.
And I think everyone who's sort of a gym junkie or has sort of looked at their nutrition from a gym perspective will appreciate it is hard to get that much protein in. It probably requires a conscious effort to ensure that you're hitting those sort of macronutrient target kind of thing.
So
Yeah.
as we said, the issue with not getting enough protein, particularly in the older adults, is muscle loss. Fancy pants name is sarcopenia. Um, and sarcopenia increases the risk of minimal trauma fractures in several ways. Yeah. So the first of the ways is if you have less and weaker muscles, then your joints are not so stable and you are literally more likely to fall over. Yeah?
Mm-hmm.
The second thing is that if your muscles are puny and you fall over, you're actually more likely to fracture that bone because it's literally got less padding. That muscles actually sort of crouch the bones and make it less likely that you will fracture. But is there any other way that sarcopenia is a problem, Dr. Moz?
Well, when the bones are sort of doing a good job, as you've said, they're sort of quilted around the muscle, and as they sort of contract and relax, they're actually sort of load bearing up and down against the muscle, so which sort of acts as a bit of a stimulus to produce more bone. So they have a protective effect from that way as well, which is quite interesting.
There is. There's also sort of the small print is that we are becoming aware, and that would be we as in the medical community, not Anne in particular, that there is sort of hormonal crosstalk in between the muscles and the bones. And if one of them is deteriorating, unfortunately they tend to drag their friends along with them. So
Yeah.
sarcopenia is to be avoided.
Absolutely. So we want to be exercising so that we make sure that we have nice, big, strong muscles, and we want to be getting protein so that our body can do stuff with the exercise that we're doing. Yep.
Yep. So we are going to talk specifically about exercise shortly, but just before we move on, there's a couple of other things still to do with nutrition and lifestyle that we'll cover. So body mass index is a really interesting one, yeah, because having a body mass index of 20, so being at the lower end of normal range for health, has twice the risk of a minimal trauma fracture than being at the upper end of healthy weight range, which will come as a disappointment to many because there are a fair few number of middle-aged women, I think to be fair more than men, who make a virtue out of trying to stay on the thin side of normal. And I think they have to understand that, well, cosmetically that might be what they want, they may in fact be harming their bones. It says it's a tough pill to swallow, but those are the stats. Twice the risk of minimal trauma fracture with a body mass index of 20 compared to a body mass index of 25.
And I think it's worth remembering that twice the risk, because I don't think we've said that about anything else, and I don't think that there's going to be anything else that's going to double the risk later on in the podcast. So that's a pretty big risk increase.
Again, a high body mass index, when you look at it superficially, it looks like it might be a little bit protective. So body mass index over 35 does appear to be associated with less risk of a minimal trauma fracture. But again, devil's in the detail. When they correct it for bone mineral density, then for any given bone mineral density, if you are obese, you're actually still at higher risk of fracture. Presumably, I'm thinking because you're at higher risk of falls. What do you think, Dr. Moz?
Yeah, it's a tricky one. And I think, like we've sort of said a bit earlier, there's lots of really complex interplay between the hormones as well. But so it's a really challenging one, isn't it? So BMI less than 20, doubling our risk. BMI greater than 35 also increases our risk. So much like for many other medical conditions, we've got to try and keep that Goldilocks healthy range.
Yeah.
It's really tough.
And the other thing is that yo-yo dieting, so weight going up and down, weight fluctuating, is also a known risk factor for minimal trauma fracture. And it says 5% fluctuation. Now, that's not actually a lot. If you're a 60 kilogram woman, 5% is 3 kilograms. So that's saying if you're normally 60 kilograms, but your weight fluctuates between 57 and 63, that fluctuation just of 3 kilograms either way is enough to increase your risk of osteoporosis. So weight maintenance, being a healthy weight, not too skinny, and trying to more or less stay the same weight. If all you were looking at was bone health, that would be desirable.
Yeah.
Good luck with that. Yeah.
Good luck indeed. I think if we managed to solve for that problem, we would have a line of people from here to the end of the universe wanting to know what our secret is, but we don't have that secret, do we, Dr. Anne?
We don't, and I do wonder how we're going to go in the decades to come with our Manjaros and Ozempic type drugs. Interesting to see what impact that has long term on bone health.
Yep,
Definitely
we'll watch this space and we'll see how we go. Yeah, topic for another day for sure.
So the other things that were bad for your bones, what a surprise, are smoking and drinking too much alcohol.
That I'm sure there are jaws on the floor that is contributing negatively to an aspect of health. So smoking, I think, increases the risk of minimal trauma by about 25%, Dr. Anne, is that right?
And too much
And
alcohol,
alcohol?
much the same, 28%. So much the same. And too much alcohol would be more than 10 standard drinks a week, or routinely having more than 4 standard drinks on a single occasion, either of those things. So both smoking and drinking increase your risk by about 25 to 28%. But again, we'll come back to being too skinny, doubles your risk. So,
And I think the other thing as well, you've said that. I'll just say it again, just in case people didn't hear it. 10 standard drinks a week. That there are plenty of patients who would happily consume 10 standard drinks a week and not consider that an excess of alcohol. And we're not here today to pass judgment. We're here to pass information on what may or may not increase your risk. 10 standard drinks. What's that? Six standard beers?
it's or a bottle and a quarter of wine.
Yeah, so that's not a lot to get through before increasing your risk of harming your bone health. So perhaps pay attention to that or consider that with your drinking behaviours.
Right.